Presentation on coronavirus COVID-19 and emergency response. History of COVID-19. Chinese authorities first identified an emerging cluster of pneumonia on Wuhan City, China in December 2019. It is a novel coronavirus till now, nomenclature as COVID-19. It is a positive sense single-stranded RNA coronavirus first reported in 2019. When first infection has been identified, history of exposure to seafood market was present. On 20 January 2020, human-to-human transmission was confirmed in Guangdong Province, China. As per WHO Situation Report up to 23rd March 2020, globally 332,930 confirmed cases has been found, while 14,510 deaths occurred. Countries mostly in Western Pacific region, European region, Eastern Mediterranean region, and region of Americas are severely affected, while Southeast Asia region and Africa region considerably less affected, though the overall situation is alarming. As per WHO, the following common sign symptoms observed infected by COVID-19: fever, cough, shortness of breath and breathing difficulties, pneumonia, severe acute respiratory syndrome, kidney failure, and eventually death. Microorganisms are transmitted by three main routes: contact transmission, droplet transmission, and airborne transmission. Contact transmission basically occurs through direct contact between the source of infection and the recipient or indirectly through contaminated object. And in case of droplet transmission, infectious agents that are transmitted through respiratory droplets that are generated by a patient affected by COVID-19 during coughing, sneezing, or talking. Transmission via large droplets requires close contact as droplets do not remain suspended in the air and generally only travel a short distance, less than 1 meter. Airborne transmission occurs through dissemination of either airborne droplet nuclei or evaporated droplets containing microorganisms that remain suspended in the air for long periods of time, or dust particles containing the infectious agent. Microorganisms carried in this manner can be dispersed widely by air currents and may be inhaled by a susceptible host within the same room or over a longer distance from the source patient. COVID-19 specific standard precaution. Healthcare workers caring for patients under investigation for COVID-19 should implement standard infection control precautions. These include basic hand hygiene, use of personal protective equipment, respiratory hygiene and etiquettes, environmental disinfectants. General precautions are: avoid close contact when you are experiencing fever and cold or flu-like symptoms. Avoid spitting in public. Seek medical care if you have a fever, cough, and difficult breathing. Cover mouth and nose with tissue, sleeves, or elbow when coughing or sneezing. Throw tissue into closed bin after use. Clean hands after coughing or sneezing and when caring for the sick. Hand washing can be done by washing hands with plain soap and water. Antiseptic hand washing can be done by the other detergents containing antiseptic agents. Alcohol-based hand rub can be done with an alcohol-containing preparation, while hand washing using an alcohol-based hand rub before operation by surgical personnel is called surgical hand washing. WHO recommended 5 critical moments of hand washing are before touching a patient, before clean or aseptic procedure, after touching a patient, after body fluid exposure risk, and finally after touching patient surroundings. When to perform hand hygiene? Let's elaborate. Upon arriving at work, before direct contact with patient, procedures on the same patient where soiling is likely, and after the contact with patient. Before putting on gloves for clinical and invasive procedures like administering IV injections, and after removing gloves. Before medicine preparations and after removing other PPEs. Before preparing, handling or eating food and after contact with blood, body fluids, secretions, excretions and wound. Before feeding a patient and after contact with items or surfaces known for likely to be contaminated. Remember, perform hand wash with soap when your hands are visibly dirty or soiled or contaminated with body fluids. Alcohol-based hand sanitizer can be used if your hands are not visibly soiled or contaminated. Keep fingernails short. Finger rings is recommended to remove while handling patient. Respiratory hygiene and cough etiquette. Persons with respiratory signs and symptoms are recommended to apply measures given below. Cover nose and mouth when coughing or sneezing with tissue or mask. Dispose of used tissues and masks into the closed waste bin. Perform hand hygiene after contact with respiratory secretions. In case of sudden episode, use upper arm during coughing and sneezing. Turn your head away from people or patients or food while sneezing or coughing. Do not touch the T-zone. In healthcare facilities, following precautions to be maintained. Place acute febrile respiratory symptomatic patients at least 1 meter away from others in common waiting areas if possible. Post visual alerts at the entrance to healthcare facilities instructing persons with respiratory symptoms to practice hygiene or cough etiquette. Consider making hand hygiene resources, tissues and masks available in common areas and areas used for the evaluation of patients with respiratory illness. Let's see how we should maintain the cough etiquette. Do not gap in between the tissues and mouth or nose. And dispose the used masks or tissues in the right bin. Yes, yellow bin. Respiratory protective device. Respiratory protective devices are of two types, masks and respirator. When currently used, would protect from aerosol or droplet-borne and airborne infection. Commonly used PPEs. Gloves, gown, waterproof apron, hair cover or cap, masks, surgical N95 particulate respirator, boots or shoe cover, goggles, face shield. These are the most commonly used PPEs. After handling of patients, decontaminate gloves with soap water or 70% alcohol. Remove personal protective equipments and either discard or for reusable, clean and disinfect according to the manufacturer's reprocessing instructions. And then wash hand. Precautions are required in following aerosol generating procedures: endotracheal intubation, open respiratory and airway suctioning, tracheostomy care, cardiopulmonary resuscitation, sputum induction, bronchoscopy, pulmonary function testing, manual ventilation before intubation. Now, transmission-based precaution in case of contact and droplet transmission. Precaution should be followed in addition to standard precautions for all patients with suspected or confirmed COVID-19. These precautions include wearing appropriate personal protective equipment, patient placement, patient transfer, and other IPC activities like disposable or dedicated patient care equipments. Airborne precautions are recommended only for aerosol generating procedures. Perform procedures in an adequately ventilated room, that is naturally ventilation with airflow of at least 160 liters per second per patient, or in negative pressure rooms with at least 12 air changes per hour and controlled direction of airflow when using mechanical ventilation. Use of a particulate respirator, certified N95 disposable particulate respirator. They must always perform the seal check. In case of community setting, precaution must be carried out. While individuals without respiratory symptoms, then avoid agglomerations and frequency of closed, crowded spaces. Maintain distance of at least 1 meter from any individual with COVID-19 respiratory symptoms. Perform hand hygiene frequently using alcohol-based hand rub if hands are not visibly soiled, or soap and water when hands are visibly soiled. If coughing or sneezing, cover nose and mouth with flexed elbow or paper tissue. Dispose of tissue immediately after use and perform hand hygiene. Refrain from touching mouth and nose. A medical mask is not required, as no evidence is available on its usefulness to protect non-sick persons. If masks are used, best practice should be followed on how to wear, remove, and dispose of them, and on hand hygiene action after removal. If the individuals with respiratory symptoms, in that case, wear a medical mask and seek medical care if experiencing fever, cough, and difficulty breathing as soon as possible or in accordance with local protocols. Follow the advice regarding appropriate mask management. In outpatient care department, for 2019 and COVID infection, the following measures should be adopted. Triage and early recognition. Place symptomatic patients in a separate waiting area. Emphasis on hand hygiene, respiratory hygiene, and supplied masks to be used by patients with respiratory symptoms. Appropriate use of contact and droplet precautions for all suspected cases. Educate patients and families about the early recognition of symptoms, basic precautions to be used, and which healthcare facility should refer to. Collecting and handling laboratory specimens from patients with suspected COVID-19. Healthcare workers who collect, handle, or transport any specimens should be trained and follow the standard precaution measures and biosafety practices. Specimen to be kept in leak-proof container and appropriate specimen bags, and to be transported in cool box with 4 ice pack. Labeling of the specimen container and a clearly written laboratory request form containing patient's ID, age, date of birth, and suspected COVID-19 of potential concern. Notify the laboratory as soon as possible that the specimen is being transported. Transfer of patient to the facility. Avoid moving and transporting patients out of their room or area unless medically necessary. If transport is required, use predetermined transport routes to minimize exposure for staff, other patients, and visitors. And have the patient using a medical mask. Use degenerated portable X-ray equipment or other designated diagnostic equipment. Ensure that healthcare workers who are transporting patients perform hand hygiene and wear appropriate personal protective equipment. Notify the area receiving the patient of any necessary precautions as early as possible before the patient's arrival. Routinely clean and disinfectant surface which the patient is in contact. Patient placement. Patients should be placed in adequately ventilated single room. For general ward, rooms with natural ventilation, adequate ventilation is considered to be 60 liters per second per patient. Single isolation room is recommended for patients on contact precautions. Patient notes or bedside chart should be kept outside the room. Donning and doffing should be done before entry and after exit from the room. Door should be kept closed. Cohorting. When single rooms are not available, suspected COVID-19 patients should be grouped together in a ward or in one corner of a ward. All patients' beds should be placed at least 1 meter apart regardless of whether they are suspected to have COVID-19 infection. Where possible, a team of healthcare workers should be designated to care exclusively for suspected or confirmed cases to reduce the risk of transmission. Spatial separation. If it is not possible to separate infected and non-infected patients, then a spatial separation of minimum 3 feet distance between the beds to reduce the risk of cross-contamination or infection occurring from direct or indirect contact or droplet transmissions. Optimum spacing between beds is 1 to 2 meters or 3 to 6 feet. Limit the number of health workers, family members, and visitors who are in contact with a suspected and confirmed COVID-19 patient. Maintain a record of all persons entering the patient's room, including all staff and visitors. This is the guideline for personal protective equipment use in different settings. In triage, healthcare professionals should use medical masks and should maintain spatial distance of at least 1 meter. Patient with respiratory symptoms should use medical mask, and patient without respiratory symptoms, no personal protective equipment required. Guideline for PPE use in different settings in case of laboratory. For the laboratory technologist and phlebotomist, medical mask, gown, gloves, goggles, N95 or face shield with medical mask should be used in case of aerosol generating procedures. In outpatient facilities, especially in consultation room, healthcare professionals should use medical mask, gown, gloves, and eye protection for physical examination of patient with respiratory symptom. For those patient who doesn't present any physical symptoms, any respiratory symptoms, then the healthcare professionals should use personal protective equipments according to standard precaution and risk assessment. Patient with respiratory symptoms should use medical mask. Patient without respiratory symptoms No personal protective equipment required. For cleaners, medical mask, gown, heavy-duty gloves, eye protection, boots or closed work shoes should be used. And ward boy should use medical masks and gloves. In outpatient facilities, especially in waiting room, patient with respiratory symptoms should use medical mask, ensure spatial distance of at least 1 meter from other patients. And those patients who has no respiratory symptoms does not require any personal protective equipments. Healthcare professionals, those are involving in ticket dispensing or other support, should maintain spatial distance of at least 1 meter and use medical mask. And other administrative areas or other administrative staffs should not require any personal protective equipments. Inpatient facilities. In patient room, healthcare personnel should use medical mask, gown, gloves, eye protection, providing direct care to suspected COVID-19 patients. In case of providing direct care to confirmed COVID-19 patients, healthcare professionals should use medical mask, gown, gloves, eye protections. In case of aerosol generating procedures performed on suspected or confirmed COVID-19 patients, should use N95 respirator, face shield with mask, gown and gloves, eye protections. For the cleaners, medical mask, gown, heavy-duty gloves, eye protection, and boots or closed work shoes should be used. In other areas of patient transit, visitors should use medical mask, gown and glove while entering the room of a COVID-19 patient. And all other staffs, including healthcare workers, in any activities which doesn't involve in contact with COVID-19 patients does not require personal protective equipments. Transfer. In case of ambulance or transfer vehicle, healthcare professionals should use medical mask, gown, gloves, and eye protection while transporting suspected COVID-19 patients to the healthcare facilities. For the drivers who are involved only in driving the patient with suspected COVID-19 and driver's compartment is separate from the COVID-19 patient, should maintain spatial distance of at least 1 meter, no PPE required. But in case of assisting with loading and unloading suspected COVID-19 patients, medical mask, gowns, gloves, eye protection should be maintained. In case of no direct contact with patient with suspected COVID-19, but no separation between drivers and patients' compartments should require using medical mask. Patient with suspected COVID-19 disease should use medical mask while transport to the referral healthcare facilities. Cleaners, in case of the ambulance or transfer vehicles, should use medical mask, gown, heavy-duty gloves, eye protection, and boots or closed working shoes while cleaning after and between transport of patients with suspected COVID-19 disease to the referral healthcare facilities. Now, environmental cleaning in healthcare facilities. Sterilization. All microorganisms, both vegetative and spore forms, can be eliminated by either physical or chemical means. Disinfection. Elimination of most microorganisms present on a surface or object. Decontamination. Disinfection of objects soiled by infectious materials. Before decontamination, cleaning processing is required to make soiled instrument or materials safe for handling and further processing. Antisepsis is a non-toxic disinfectant that can be used on skin and living tissue. Cleaning agents and disinfectants. 1% sodium hypochlorite can be used as a disinfectant for cleaning and disinfection. It should be prepared in light protected color container and used within 24 hours. Contact time of solutions at least 20 minutes. 70% alcohol can be used for hand sanitation and also for surfaces where bleach is not suitable, like metals, tables. Frequency of cleaning. High touch areas or surfaces. Doorknobs, telephone, call bells, bed rails, stair rails, light switches, lift buttons, armrest table, air or light controls, keyboards, switches, basin, wall area around the toilet, etc. should be disinfected every 3 to 4 hours. Low touch surfaces. Walls, mirrors, etc. mopping should be done at least once daily. In between patient care, 70% alcohol containing hand sanitizer. Equipment should be single-used and disposable or dedicated equipment. If it needs to be shared among patients, clean and disinfect in between use for each individual patient. Example, 40% alcohol. Frequency of cleaning. Triage area. Disinfection of high-touch surfaces by 1% sodium hypochlorite solution should be done in every 3 to 4 hours. After attending each patient, healthcare workers should maintain hand hygiene. Mop routinely floor with available disinfectants, 1% hypochlorite solution, phenol, etc. Linen. Removed curtains, fabrics, quilts should be washed by using the hot water cycle. Wash with detergent or soap or in water at 30 degrees Celsius for at least 25 minutes. Preparation of 1% sodium hypochlorite solution. 5% solution is to be diluted 200 ml in 1 liter of water. 10% solution is to be diluted 100 ml in 1 liter of water. For 1% solution, 10 liter water plus 400 gram bleach powder in a 17 liter bucket. Preparation should be done in red colored covered bucket and mix it by wooden stirrer. Bleach should be poured in previously water-filled jacket. Preparation of 70% alcohol. 99.9% ethanol is available in the market. 100 ml 70% alcohol equals 70 ml ethanol plus 30 ml distilled water. 10 ml 70% ethanol requires 70 ml ethanol plus 3 ml distilled water. That's all. Stay safe and thank you.